Hi, so it's this is Brendan, and it's another episode of Let's Chat Health Tech. And we have the good fortune today of having Katie Davis. She's a fractional clinical operations and compliance person. Her company is Health Shift Leaders, and she's 20. She's got 25 years of healthcare experience, and in the last decade at executive level in health tech companies and working with health tech companies. And she's been a founding member of a number of multiple startups, including one that's a YC-backed company. There's a story there. And now she advises both early stage and large health systems. I think the note here is 13 billion and up, not for profit, but Fortune 500 scale companies. So with that, welcome, Katie. What'd I miss? Anything I should have added?
I think you covered most of it. I guess one key piece that is that I'm a nurse practitioner by training and back switching into fractional leadership.
That's great. I tell you, I think that's that's an incredibly valuable kind of background and expertise and experience to have because I'll let you add to this, but it just you have such breadth of knowledge and understanding of what's right and what's wrong and workflows and the politics and all the dynamics and that sort of thing. So why don't we jump in there? You started as a clinician, and what was that like, and what was the motivation to move over on the business side and the operational side? And I mean, just explain that for the audience, because that will be, for my audience, that is a very useful kind of conversation.
Awesome. Yeah, it really was a progression over time, moving from honestly, I started as an EMT, and
Oh,
then
really? Oh, yeah.
was a nurse and then a nurse practitioner. And really just my goal is to keep moving toward where I could have more impact. So early on, I was at the bedside. Over time, I started to see there were a lot of decisions shaping patient care that were happening upstream. That was through operations, business decisions, how the models were designed themselves. So I really started to move from delivering the care to building the systems that deliver the care. And what I found is when you get that right, obviously you're not just impacting one patient at that point, you're impacting thousands. So I like to say that I didn't leave clinical work. I'm just scaling the clinical.
Okay. Oh, very good. I was a volunteer fireman for 7 years,
Right.
and I always thought, oh yeah, being an EMT would be pretty cool, but then it's so much work. I mean, so much to learn, right?
I still volunteer as an EMT, so I
Do
still
you
have
really? Good for you.
to work on the ambulance.
Oh, good for you. That's great. I did the fireman thing for 7 years and was interior trained and all that, and which was actually a lot of work and fascinating. But that's a whole level above that, if you ask me. So so what's the biggest disconnect you see between a great clinical idea and what actually happens, or what works, and what are the dynamics get in the way, and all that sort of stuff?
Yeah, absolutely. So I think on the clinical side, you either have non-clinical founders who have a really great clinical idea, right? And or you have clinical founders who have a great clinical idea. And it's not really like the clinical idea, obviously they recognize will solve at least one patient's problem, but it's getting from clinical idea to scalable model that solves a system problem is where I think everyone struggles, whether you are a clinician or a non-clinical founder. And it's for different reasons, right? So as a non-clinical founder, you have to learn the clinical side. You have to learn the ins and outs, or you have to have a partner that is very strong in those areas and can help support. On the clinical side, you have to learn the business and the finance to make sure that the clinical idea can actually translate into something that is ultimately scalable, that has margin and delivers the right patient outcomes. So I think really what I have found is if you can find a clinician that has learned the business of healthcare, it's a little bit of a secret weapon. Building like that gap has been really impressive for the models that I've seen ultimately scale. Even if you don't have that internally, trying to find someone to help bridge that gap that can truly speak clinical, speak operations, understand the compliance, and speak finance is really huge.
Yeah, yeah. I'm finding that in my work, I'm starting to do more of that, where I'm finding clinical people, nurses in particular, and then teaching them over a period of time the fundamentals of sales and sales execution, how to conduct a sales call, that sort of thing. And then what they're able to do is match that up with understanding the mindset of physicians and administrative staff and all that, and and even IT and procurement. So if I'm going in and selling to a clinician, and nurses call the shots as often as the doctors, I think. Like, what are the sorts of things that a salesperson should be thinking about when they approach and the clinical side folks?
Yeah, honestly, it sounds like you've probably hit a little bit of a niche with what you're talking about in building up the sales uh kind of aspects and education
Yeah,
and skills for nurses,
yeah,
because you can always train a clinician on the sales side, to your point,
right.
right? And
Yeah,
and the clinician, hands down, is going to connect to that other clinical leader
yeah,
over anyone else.
yeah,
The number of folks that maybe I've reached out to, for example, on LinkedIn with a request on the clinical side versus a counterpart, right, that is non-clinical, I'll almost always get a response.
yeah,
And same goes for me. If I have a clinician reaching out to me about something, I'll respond. If I'm getting like the normal say pitch, right, like coming into LinkedIn messages,
yeah,
it's not as interesting to me.
right.
So I think honestly, the niche that you found with pulling clinicians to be able to learn the skill of sales is would be huge in thinking about selling to a clinician. Otherwise, if you don't have a clinician that's going to do sales and you're going to approach a clinician, my best advice would be spend time understanding them for
Yeah,
real, right?
yeah,
Like, go, if you're selling to a hospital, a health system, whatever it may be, go figure out how you can shadow for a week, right? Same thing, like whether it's a nursing home, whatever it may be, you have to deeply understand the problem that
yep,
is getting solved so that
yep.
you can articulate that in a more authentic manner to the clinician.
Yeah, I totally agree. One of the things I try to talk about is if you're selling into the clinical setting, doctors' offices, hospitals, one of the things you should immediately do is use the opportunities when you are in a hospital or a doctor's office to observe things more acutely. Talk to the people that are behind the desk. Ask them things about what's going on. Notice how things operate inside the organ. It's amazing how much you can learn about things if you just ask a few questions in the course of it, because everyone's always appreciates a little curiosity and interest in whatever their area is. So if you start to ping them with a few questions. The other thing I would say is, and you jump in here, another other tips, but one is you have to be really crisp with what you ask of them because they're busy and overworked, and they're probably on their way to somewhere else. There's some other ding that they've got to go respond to, or text message or chart and so forth.
Yeah. Yeah.
Anything else?
No, I absolutely agree with that. They're always busy. And it really is that messaging, right? It's getting, I think the hardest part is getting foot into the door and getting the time of day. Once you have their attention though, then you have their attention. And it's more at that point about um your product, what you're selling, and the fact that it needs to impact the patient's life, right?
Yeah,
In a
right,
positive way with outcome. It has to impact the provider in a positive way, and not otherwise create unnecessary friction.
right. Now that you've been you've been on both sides of the fence, so to speak. What are you seeing? Any interesting trends or directions that you're seeing in the health plans and health systems? What's catching your attention?
So I'd say on the startup side, definitely I'm recognizing that obviously given the current environment around funding, obviously unless you're an AI company, right? So AI companies are getting funded. But outside of that right now, especially in more of the services business, you have to be margin accretive. Like it used to be build something that folks need or want, they'll come, right? And VC, PE, they'll fund it. Now you have to have a crisp line to getting to the point where you're EBITDA positive and then and margin positive. And I have found that startups are starting to dabble in a lot of the work that I do, which is fractional work. So really starting to pull in fractional executives, recognizing costs so much money to hire a full-time executive in that area. But I could get 50%, 20% of that person's time. They're still going to roll up their sleeves and help execute, but at a fraction of the cost if we pulled them in full time. So that is a really interesting trend that I'm seeing. I think is really valuable for both startups and those fractional executives that are able to provide their experience and expertise across a number of organizations.
Yeah, I think that makes a ton of sense. I mean, I was in the fractional sales world for quite a while before, and there's a potential. There's such a attractive potential for allowing you to scale, and and then fully staff for that position when you need someone. So you're not locked into a certain person for. And if you get 20% of their time or 50% of their time, and then one of two things happens, you get to the point where they hire you full time and you decide I'm going to be an employee because it's attractive enough to do so, or you bow out and transition to a full time person, and then you go off and do your next thing. I think that makes a ton of sense, and I'm trying to do that same thing with some of the staffing people that I do is the same way is to get them to ramp up and help the senior team sell, and then ultimately they grow into a role or they move on.
Yeah,
Uh,
absolutely.
oh, other like What are the other trends? And then of course you're wrestling with AI. I have a particular thing about AI that like one of the things I'm seeing is and AI has really accelerated this, and that is I call this the Cambrian explosion of apps and solutions. I mean, I think hospitals in particular, hospitals and health plans both are getting just inundated with lots and lots of new shiny object things to consider. Now, if you had a hot thing a while ago, a real solution, the chances are there weren't 10 of them out there that were competing for the same attention. And now they're just buried, with options and resource constraints and attention span issues. And I just think that we're seeing the need for sales to elevate and become much more sophisticated and much more strategic is going to become a big thing. Are you seeing that or other kind of like real tectonic shifts in your world?
Yeah, absolutely. And I think touching on that, health systems, health plans, I really think they're starting to move a little bit away from like more of the experimentation, right? They used to your point, they used to probably say yes to 10 of
Yeah.
those and
Yeah.
say like, sure, we'll try little pilots, right? Like in all of these different areas. Now I'm seeing that they need to move to execution, right? And so they're needing to move beyond the innovation, the pilots, the new models. There's real pressure, similar to startups, to make sure something actually works operationally, financially, that there's a margin associated with it. So being able to parse through all of that and lead a sales effort that allows you to stand out because they're not going to try 10 anymore,
Right.
right?
Yeah.
Is going to be really important.
Yeah, and on top of that, if there are 10 in an area, like if you think in terms of apps, consumer facing, patient facing apps, you can't even count the number of or revenue cycle management solutions. And so now that one of the dilemmas they're faced with is, oh, there are 10. And which
Yes.
one do we bet on? Because all 10 of them aren't going to survive. And so now they're really, you've got the deer in the headlights look, partly because there are too many good choices. And how do you pick the one that's going to be around for a while? And what do I do if I migrate? And, are you seeing hospital systems build their own stuff now, or they're still, yeah,
They're trying, right? Like, for certain things that, have a pretty clear sight line, they're trying,
yeah,
but there's also it doesn't make sense in a lot of areas for them to build these solutions internally when there's entire businesses that have been standing, like, operating for years, right? Fine-tuning the AI, fine-tuning the algorithm. I think the biggest thing for health systems right now is finding something that fits. right? Like, can it be customizable? To your point, that's that's why they would try to veer off and build something on their own because they feel like it's not customized solution for their entity. And I think they're also trying to move beyond where possible. And I'm seeing this in the venture community as well at this point, trying to move beyond some of the point solutions to look for platform solutions. So something that, okay, you can do billing and rev cycle. How hard is it to add on front desk, right? Like they don't want 50 point solutions now that they have to figure out how to mesh together. They want something that's going to be more cohesive and comprehensive.
Yeah. I think that's yeah, which lends itself to does that lend itself to companies like Epic just sort of swallowing everybody up and just like, "Oh, I'm gonna go with not best of breed, but, most likely to survive."
It's it's tough. I mean, I think you've probably hit on a relatively polarizing topic for folks in terms of which way they're going to go.
Yeah,
But yeah, I mean, you're right. Path of least resistance is run Epic. Epic has a solution and it's embedded.
yeah,
We're going to go with Epic, right?
yeah, right.
I think there are a number of entities and organizations though that aren't on Epic. So
Yeah, yeah,
it's there are still some groups that need more platform-based solutions that don't have the resources to be on the Epics of the world or even some of the other large EHRs, right? You are starting to see a number of what we've identified as headless EHRs come out now because of this reason. They're recognizing that folks need to be able to integrate all these components with their EHR. So they're building the new EHRs now to connect to almost anything.
yeah, yeah. I was, at an event a couple nights ago, Pixar's event. The fellow running it, said, Now's not a good time to to sell software," right? That because, now you can create your own thing. You need a CRM, why buy Salesforce or HubSpot? Just why don't you build your own? And then it becomes exactly what you need. I wonder if hospitals and health systems and health plans will do that. I mean, I don't know. One of the constraints, I think, correct me if I'm wrong here, but it's probably hard for them to recruit the kind of talent, that kind of expensive AI talent that they need, right? Is that a
Yeah, I also
fair
don't know
assessment?
if they're willing to invest in the in-house talent,
Yeah,
right? Like a lot
right,
of health systems would prefer a consultant, would prefer an external group that has specialized expertise that will help support them kind of execute. So I imagine it'll take a long time, if at all, before we see most health systems, I'll say, building those functionalities internally. There's, of course, going to be a few that are out there ahead of the rest. Those are the ones, though, with incredibly strong, well known CMIOs, right?
right. Like
Where you're
yes,
combining the medicine
right,
and the information technology and even then, only a couple come to mind that actually have the true technical experience, not just
right,
IT, but like engineering, like
yeah,
computer engineering experience
yeah.
to know how to put together the clinical engineering and kind of AI components.
Yeah, that's fascinating you say that. I mean, I'm particularly impressed with, like, for example, to drop names, but Cleveland Clinic, I think, is in that category. They've been really good
Yeah.
at that. And then there are others whose names I won't mention that are world class and don't have that, that, depth and breadth of capability. So, and I guess that you know what that does? That kind of brings us to your kind of the stuff that you're particularly doing. You work with a lot of large health systems. Do you and health plans too, or just health systems mostly?
Mainly health systems.
Okay. And so tell me more about what's that like? What are they wrestling with? I know it's revenue for sure. The big beautiful bill is gonna harm a bunch of the especially rural hospitals, I think, and I think, safety net hospitals too. So what are the things that are worrying them? What are the things that you're advising them on? I mean, I don't want you to I know you're expensive and your stuff's top secret, so you don't give us any secrets, but, like,
Okay.
just generally,
Okay.
what sorts of problems are you seeing, or what sorts of circumstances are you running up against?
Yeah, so obviously the macro market, as you identified, of course, right? You've had also CMS drop what, over 6 new models
Yeah,
in the last
right,
9 months, right? Like, I think somewhat to counteract some of the big beautiful bill components, right? They're trying to give more access to the rural health systems and patient populations. But honestly, what I'm seeing in the health systems is somewhat similar to what startups are struggling with. It still comes down to operations, margin, revenue, right? So, one particular system I'm supporting right now, it's actually about revamping their entire provider onboarding and payer enrollment function. And it's how do we create more efficiency? To your point, how do we leverage technology appropriately to help create some of that efficiency, revamp the entire kind of data provider data management system, and then restructure so that all of this works and works well.
right.
And it's kind of funny because a lot of times people are shocked. They're like, "Wait, startup versus like $13 billion health system? What do you mean?" The problems are similar, just on different scale, right? And it's a little harder, obviously, to turn the health system ship as quickly as I can on the startup side, but at core, it's how are you leaning in, understanding what's going on, and then helping to optimize operations.
Okay, yeah, I'd argue with you a little bit, just having sold to a lot of hospitals and health plans versus working with startups is that I mean, I find I love the work that I do, and I like the fact that it's complex and often and oftentimes quite frustrating. But it's amazing to me how hidebound and slow moving and consensus driven certain large organizations can be. And but at the same time, it's because of that that I have stuff that I can do, right? So you but you're right. I'm sure that in a lot of cases, the where to focus, what to fix, what to operationalize is all, I mean, it's probably true for, for both small and large companies.
Yeah, and I think having similar to your experience, right? Having both startup experience and large system experience, you know how quickly things can move, right? Because you've
Yeah,
done it in a
yeah,
startup and you can bring some of that kind of fire to the health system side that they're not used to. And try to push things along a little bit faster.
yeah,
Obviously, in the most delicate way possible, because you need
yeah.
point the consensus side of the house, right? But it is interesting to try and push them along a little bit faster.
Yeah, yeah, yeah. What I'm just trying to think if there are other kind of macro trends that you're seeing, anything else that comes out to, I mean, in the space? Like, I'm racking my brain as to I had one in mind, and now I can't think of it. Anything in particular?
I mean, obviously, some of the value-based work, right, and arrangements, you still have that push-pull between fee-for-service and value, trying to move a little bit closer to value,
Yeah,
especially with some of the CMS models that are trying to push using technology, yet also measuring outcomes. So beyond the cost containment and revenue optimization, I do think folks are continuing to try and find opportunities with delivering value-based care, whether they're delivering fee for service or otherwise.
yeah. I know what I was gonna say. Going back to AI, I'm of this opinion that, speaking of business models, I think we're going to see invariably, we're going to see some disruptive sorts of new models that come out and new companies that come out of this. I mean, and I'm just spitballing here, but you've got, all these claims typically have been going through EDI, right? Even today, right? Or there are, workflows or customer, member support, member and patient support systems and interfaces that I think are gonna be radically changed by what's happening with AI, and someone's gonna figure this out at some level, various companies, and I think we're rife for all sorts of disruption, and I wonder if you're gonna start to see the invention of new types of health plans, and And I gotta think there potential for new types of health systems that are, on the horizon. Any thoughts on that? I'll kinda
Yeah, I already am starting to see new types of health plans, to your point. I've actually been part of a number of conversations about creations of new types of plans.
yeah,
Definitely a little bit more in the self-insured model, right? So trying to pull together various groupings of individuals to ensure more capitated rates
yep,
for primary care, right? Your normal day-to-day care, really trying to make that incredibly low cost and having the backup insurance for the significant events, right?
right. Yep,
So it has been interesting. It's funny you mentioned that there have been a couple conversations where folks are trying to think about the health plan structure very differently. I think a lot of folks are upset with the current structure, right? You've got insurance that's covering patients, and patients are still concerned and complaining that there's not real coverage,
yeah,
right? They
right.
have a high deductible. That means they're paying out of pocket before they even see insurance coverage, except for some of the more primary care based functions.
Yeah. Yeah, I think that's it'll we're living in interesting times that way. So, and very unpredictable times going forward. It'll be interesting to see how everything plays out.
Absolutely.
Well, Katie, just this is great. I really appreciate the chance to kind of learn a little bit from you and hit you up with a few questions. And like before we close out, is there any kind of last comments or advice or suggestions you might have for the from my audience or for me?
Well, I first appreciate the opportunity to chat, and likewise, I love learning from individuals that are in different areas. I think it's really helpful to learn from each other's expertise. But otherwise, yeah, I mean, I think the biggest thing here is really if you have a company that's operating in healthcare and it's impacting patients or clinicians, make sure there's a clinician somewhere in them. Whether it's you training nurses on the sales side, or on the clinical side, making sure you've got a chief clinical officer, a chief medical officer, or even a fractional is vitally important. I think for any of these companies on the commercial side to ultimately succeed. So that would definitely be the one plug here is make sure you've got a clinician on the team.
That's good. That's good advice, I think. And for what it's worth, I mean, the reason why I like to do these podcasts is I think if you're on the sales side selling into health plans, health systems, providers, it's just incredibly important to understand things in a much broader context and with more, with insight from different perspectives. And so I appreciate your being able to share your perspective and your experience and some potential things to think about going forward. So, Katie, thanks for your time. We'll have your contact information in the show notes. And last words, we're good to go. It's up to you.
Thank you so much. It was
All
a
right.
pleasure.
All right. Thanks, Katie.
Take care.
Bye bye.